Thank you very much, Madam Speaker. And today we're talking about healthcare, something that Canadians value. A healthcare system that would ensure that no matter who you are, how much you make, where you live, or what circumstances you may otherwise find yourself in, that our healthcare system, the very backbone of our social safety net, the core value that Canadians right across the country praise. And Madam Speaker, that is at risk today. There's an insidious and nefarious project underway in Canada, a project that would seek to take away that very protection. In my home province of Alberta, it's already begun. The Premier of Alberta is utilizing existing public funds to funnel that into the private care system that would otherwise be used for public care. And Madam Speaker, this actually cannibalizes our existing public healthcare system. It is a fallacy, it is a myth that the private healthcare system can in fact make things better. It's no secret to many Canadians who've had to put up this fight before, including the Democratic Party, that have always been steadfast in the defense of our public healthcare system. They would seek to defund. They would seek to take away the supports of our public healthcare system in order to ensure that the public begins to see that deterioration which builds public support for private healthcare systems. That's what's happening in Canada right now, Madam Speaker. Our public healthcare system is falling victim to a classic trap, a classic privatization trap, whether it's education or healthcare, that would seek to destroy our social safety net. Madam Speaker, the intentions of the Canada Health Act, looking back to my home prairies, the real people that have been saved through public health care. The fight that began, it grew on the prairies to ensure that no matter who you were, the neighbors that you farmed with, the post office person, the teacher, the person constructing our roads, that regardless of how the economy may have hurt them, that they would have that basic level of humanity. It's not the job of the government to solely look at the GDP of the country. It's important that the country actually ensure that the people who develop the means and the surplus to make so much possible in this country actually get control and benefit from those surpluses. And part of that is making sure that the basic need, healthcare, is looked after. Imagine our country, Madam Speaker, a country that would seek to see people like Danielle Smith and her project to give everyone $375 in an account to otherwise privatize our healthcare system in my province. If that, Madam Speaker, was possible and that was something that we did right across this country, millions of Canadians would be left behind. It would leave behind this country's most vulnerable people. Premier Danielle Smith, as evidence of this, published a paper through the University of Calgary School of Public Policy where she suggested creating the annual health copay fees of up to $1,000 annually based on income. She said, and I quote, "Once people get used to the concept of paying out of pocket for more things themselves, then we can change the conversation on healthcare." Shame, Madam Speaker, that she would otherwise shackle those who are most vulnerable, those who need healthcare most, to the limit of $1,000. We know that one night in a hospital is at least $3,000. Who would she otherwise want to toss out onto the street? Who would she otherwise want to ensure didn't get that care? On top of all that, Madam Speaker, our hospitals and the condition they're in today is truly deplorable. Because before you get to the point of proposing a solution like Danielle Smith has, you got to break the system first. You got to break the public health care. And that starts with attacking workers. It starts with attacking our public health care workers. It starts with attacking our care economy. The brave men and women and non-binary folks who work in our healthcare system today are the people, the same people, that helped us through one of this country's worst nightmares. A global pandemic that would have otherwise left millions of Canadians behind if we didn't have a public healthcare system. Even though it's so massively underfunded and the conditions these workers were placed in, they stepped up. They were heroes. This House praised them. Conservatives, the Bloc, the Liberals, all alike called them heroes. And when I talk to healthcare workers in my province today, they feel like zeros. Because that's what they're getting at the bargaining table. That's what they're getting in their contracts. When we value our healthcare professionals, when we value those who work in them, we value our healthcare system. And these people aren't looking for profits. They're looking to have the tools to help their neighbors, to help their family members, to help the people that they grew up with, to help the provinces that they love. But Madam Speaker, the conditions they're being forced into are forcing them into a narrow corner and a decision they have to make to either leave the healthcare system altogether or enter a growing private sector that would seek to abuse them, that would seek to take away their rights, and that would seek to take profit from those who are sick. Shame.
Shame.
Shame. Madam Speaker, Alberta can be a prosperous, beautiful, strong, and resilient place, so long as we ensure that the principles that we've agreed to our province help build, which is our public healthcare system, are truly adhered to and valued. And part of that, Madam Speaker, is looking back at that history, looking back at those who have had experienced what this healthcare system that we had before our socialized healthcare system was like. And I talked to people. I talked to a nurse, a retired nurse in my riding. She came to me just last weekend and said, "Blake, please stop the privatization of healthcare. I know exactly what that feels like. I've lived through it before." In Alberta and other provinces, before our national healthcare program was built and still being built and albeit today defending, she had to go through the onerous process of having to get an insurer, having to ask someone to insure her husband's life. And when she couldn't afford to make those payments, guess what that insurer said? Too bad, so sad. Her husband needed insulin. Her husband needed medical attention. Her husband was a hard worker, worked on a farm his whole life, and of course there's realities to that kind of labor. And when we don't provide that social safety net to those who rely on it most, we leave them behind, and it hurts our economy for it. We need to take a stand against US-style for-profit healthcare. Because, Madam Speaker, that is part of the problem here. We have mega corporations that would love to dine out on the public dollar, that would love to continue to make a literal killing off of people who are needing that support. Our job in this place is to ensure that Canadians have the tools and the social safety net to succeed, that when, not if they fall down, when, because we're all human, when they fall down, they can get back up. That's the kind of promise that Canadians are fighting for today. That's the kind of progress that New Democrats are fighting for today, to make a truly universal, universally accepted public healthcare system that can withstand the conditions of labor we put onto individuals who give their bodies to this country and find themselves lesser for it, and a government that's not willing to make sure that they have that health care. It's for those teachers that they can ensure that no matter what happens to them, especially throughout COVID, that they themselves can continue to do the work of standing on the front lines. Madam Speaker, and I'll end with this. The working class of this country are being divided. They're being attacked. And they're doing it in order for us to not look at the real problem. Those corporations that would seek to profit and the politicians they pay for ignore this issue. They want us to ignore the fact that our public healthcare system is under attack. They want us to ignore the fact that for-profit surgeries are already taking place in my home province of Alberta. And this government needs to enforce the Health Care Act. It's written clearly. And if they do that, Madam Speaker, and ensure that people like Danielle Smith can't continue to finance the private healthcare system like they are today, and I welcome the Liberals to come over to Alberta and take a look at some of the private healthcare systems, because they obviously don't believe it today. And talk to the people who are needing this service and talk to them how much it costs to get a hip replacement. Madam Speaker, we're here to defend public health care, and we will continue to do that. Thank you very much.